Hey guys, my name is Dan, I'm a veterinarian, and welcome to the channel. Does your dog have hip dysplasia? Today I'm going to talk over what you may notice at home, what the veterinarian is going to do at the veterinary hospital, diagnose it, and what to expect just moving forward and how to treat it, manage it, surgical options, and medical options. Hip dysplasia can have a handful of things wrong with the hip. Now the femur, the head of the femur, when it goes into the socket, it should be a true ball and socket joint, meaning we have a ball and a socket, it clicks in and it is smooth. When it's not smooth and we have hip dysplasia, your femoral head may be more of a rectangle or maybe completely missing and be very abnormal. So when you have your socket on your pelvis or your hip, maybe it's really shallow or it's really poorly formed. Either way, if you don't have a beautiful ball and socket that clicks in and smooth, if you have grinding and clicking and luxating, that's when you have hip dysplasia. Hip dysplasia can be treated in a handful of different ways. Starting off with just joint supplements like chondroitin and glucosamine. These are great options and can be really helpful with improving the joint health. In more severe cases, non-steroidal anti-inflammatories can be incredibly helpful to help out with orthopedic pain and inflammation. More recently, more options have become available like cold laser therapy or chiropractic work or even monoclonal antibody therapy. For these, always talk to your veterinarian and see if they will be a good option for you and help your doggy get more mobile. After medical options have either not done a good job or have failed, or if we don't want to do something long-term like this, you can always consult with a veterinarian or veterinary surgeon and do surgery. There are two most common options. You have the FHO, which is the femoral head osteectomy, and that is just that. It's gonna blow your mind, guys. It's when the veterinarian literally cuts the head of the femur off so it can't grind and scrape against the cartilage in the hip. If we no longer have bone-on-bone contact, the doggy is no longer painful. Yes, that sounds like it would not work and the leg would be flopping all over the place, but the dog has a lot of really strong muscle attachments. The dog will form a false joint, and you know what? The dog does really well. I've seen really big dogs that have had both legs done that still run and play and do well. This is a salvage procedure. This is something that we can't take back, and this is something that may not give you a perfect hip in a dog. They may have some lameness still, they may have some pain still. Can we resolve a lot of it? Yes, but it's not perfect at any length. The other option, guys, would be a total hip. Total hips are amazing. This is when you go see a specialist and they literally do very similar medicine as humans, putting in an implant for the total hip. Total hips are as well incredibly expensive. A lot of people are spending between $6,000 to $8,000 for a total hip, but total hips are superior to the FHO. Total hips will give your doggy a great range of motion, reducing pain, and my goodness, these doggies do incredibly well, and the total hip has progressed just a ton over the last few years. With that being said, it's expensive, and the FHO is about a quarter of the price. So if the doggy is uncomfortable and surgery is something we need to move forward with, surgery by itself, picking one or the other, will most likely give your dog a happier, healthy life if they are chronically painful and medicine is not doing the trick for you. Hip dysplasia that's mild, a doggy may have it really early in life and they may show very few symptoms. As the doggy gets older, anything that is dysplastic or abnormal like hip dysplasia will progressively get worse. Now, some doggies have severe hip dysplasia, so when they're 1, we see it already. And even though it's going to keep getting worse, it doesn't matter, guys. It's already horrible, and the pet parent can already see it and notice it, and it's a problem. So hip dysplasia, guys, it's hereditary. The dog's born with it. With that being said, you can have mild or severe, and both forms of it will get worse with age, but some of them, you have to address it when they're 10. Others, you address it when they're 1. It just depends on how bad it is. And most veterinarians will diagnose hip dysplasia with a history. Maybe the doggy is bunny hopping, or they don't want to go upstairs or downstairs. Maybe they're crying out in pain when an owner pets or rubs the back legs. Also, guys, looking at the back legs, sometimes they'll be atrophied, so the muscle, you have some muscle wasting, and the muscle won't be as predominant on the back legs because they're using a lot of the front legs compared to the back legs because the back legs hurt. Some dogs will have more of a skip, or they will change their gait, and sometimes they'll go back and forth with the leg that hurts less. Sometimes if they walk along the right side, they'll pivot to the left side and then the right side they'll limp on, depending on which side is being used more often. As always, guys, my name is Dan, I'm a veterinarian. Thank you so much for watching this video. I really appreciate it. If you wouldn't mind subscribing or liking, that'd be great. And I hope this video has provided you with some knowledge about hip dysplasia. You guys take care. Bye.